he goes, someone in your family has asthma, hay fever, eczema, allergies in general, and some other allergic type of conditions. And he goes, you want to know how I know? And I go, yeah. He goes, you have allergic shiners under your eyes. Those dark circles under your eyes.
Well, she's right. These are called allergic shiners. Shiner is in, like, you get a good shiner, so somebody's punching you in the nose, or the eye, rather. The idea of shiner is that this area underneath the eyes becomes dark. And that's because of exposure to seasonal allergens and a seasonal allergic response. What's happening is the blood vessels that are kind of close to the skin in this area, they start swelling, expanding, and pooling with blood, and that causes that sort of dark appearance called allergic shiners. I can tell you, honestly, when I go to CVS or to the store or whatever, I can walk around and kind of look at people often and tell who has allergies. This next one is called the Allergic Salute, okay? If you look closely, you can see that there are what we call transverse lines going this way across the nose, okay? If you Google this as well, there's a number of pictures online with people of different skin tones. Sometimes it's really easy to see. And you know what that comes from? That comes from this. Literally, it comes from doing this, wiping your nose with the back of your hand. And that motion continually, see how it pushes the nose up? You can get a crease here, crease there. That motion can, I wonder if you can get a crease there. Look at that crease. But the idea is you can get these creases as a result of this constant pushing up of the nose. This next sign is actually me. This is at the beginning of this allergy season. My allergies have been the worst they have ever been this allergy season. I am currently taking an oral antihistamine, a pill. I'm taking a steroid nasal spray, and I also have to take allergy eye drops as well. And this video is from the very beginning of when the allergies were starting to flare up I think this is before I got my allergy eye drops. So what you see there are these little lines underneath the lower eyelids. They're called Denny Morgan lines. That's right, they have a name too. Now, they kind of look like little wrinkles. I suppose with me they could be wrinkles, right? But we also see them in children and people of all ages because it can be a sign literally of seasonal allergies. So you can get these Denny Morgan lines. That's also another sign. I also feel like in this video I also have the allergic shiners as well. You see there's that puffiness and sort of a darkness underneath my eyes both sides. And that's before I really got started with the full allergy regimen that I'm on now. I'm doing a lot better now. In the doctor's office, when we do our physical exam and we're looking at the head, ears, eyes, nose, and throat, we often look in your nose. And one thing you can try at home is if you stick your nose up like this to a mirror and look in, those people with seasonal allergies often have what we call enlarged turbinates. That is, the little things bulge out on the inside, okay? And you can see these big, almost like little big bulging things. The turbinates are enlarged as a result of the seasonal allergies, and often they're just there churning out mucus. Mine look pretty decent now, but in people with really bad allergies, those turbinates can be very large, so you can take a look at your own and see what they look like. Another thing is when I look in someone's mouth, oh gosh, you can see all the way in there. I don't think I have much of it, but I'm looking for something in my patients called cobblestoning. I couldn't find a picture of it online that I was able to use, but basically the back of the throat literally looks like a cobblestone street, and that's a result of postnasal drip from the nose sort of dripping back and irritating the back of the throat. So those are some definite signs that we see. Sometimes we also see fluid behind the ears, behind the tympanic membrane. Sometimes we see sort of like a bluish discoloration of the nose. There are a lot of physical signs of seasonal allergies, or even more than what I'm just mentioning here, but that's a start for you. There are a lot of great medications out there, and if you feel like the medications you're taking are not working, see your doctor, because you may need further treatment. You might need allergy shots. You might need to see an allergist. I'm just letting you know this to know that don't stop. There is likely relief for you. Guys, I'm Dr. Jen Caudle, practicing family physician. Please subscribe to my channel, click the little bell for updates, follow me on Facebook, TikTok, LinkedIn, WhatsApp, Instagram, Threads, everywhere, and sign up for my free health newsletter at drjencaudle.com.